All right, I'm going to show you how to, in about 2 minutes or so, avoid meniscus tear surgery. It's oftentimes misdiagnosed as the cause of this knee entrapment or locking. And so first I'm going to show you my right knee has this very condition, which would normally be diagnosed then as some sort of meniscus tear, needing, of course, surgery, which would not fix it because that's not the problem. And so when I go into, I don't know if I'll be able to catch the audio. Oh, maybe you can hear this. So my knee is locked now, and it's very painful to try to extend, break it out of the lock, and you can hear it when it snaps back into place. Okay, so this would normally be considered a meniscus tear. I'm going to fix it in about 30 seconds or a minute without any surgery. What's happening is that the tibia is actually sliding too far ahead and even above where it needs to in the extreme bend. So some people will experience this when they cross their legs for a while. They'll have that position where it shifts too far forward and it gets trapped actually in front of the knee effectively. So all you need to do really is put the sliding pressure toward the body so that it does not jut forward. And you can retrain this, and we'll see. So I'm going to put enough pressure, I don't know if you can see this, I'm putting pressure right here, right at the top medial aspect of the tibia. And I'm drawing in toward the body. I'm going to do that so that I can bend without that clunking, without that shifting, a few times, retraining the tissue, my body, and the nervous system that it's okay to go into that position, putting a lot of pressure, hot pressure right into that, where it would normally jut forward. You can see I can now go into a full stretched knee bend and extend out of it with modest clunk there. Let's see if we can eliminate it altogether. I'll keep the pressure on. Gone. Smooth. So it takes a little time to restore that completely. You can use banded pressure to pull it back in and use squats, but in time you can actually completely retrain that. You don't need to do surgery for it. It's not to say that there aren't real meniscus tears. There are, but this sort of clunking, painful knee locking, in my experience over the last 15 years or so, more often than not, there's some sort of tibia-fibular instability, and if we can retrain it back into place and build strength around the connective tissue, problem solved. And in this particular case, you know, we did it in whatever that was, 90 seconds or so.